Mic check. Hi everyone, welcome to Webinar Wednesday. I am your host Kia and I want to thank you all for joining us. Today's speaker is Dr. Melanie Mozoon and is going to cover flu plus U and immunizations. She's just going to explain the how, why, and whens of immunizations. For some more information on Dr. Mozoon, her clinical interests include breastfeeding, immunizations, neonatology, growth problems, sports medicine, and dermatology. Dr. Mozoon joined Kelsey-Seybold in August 1985 and practices at our Women's Center. As a reminder, we'll be taking questions at the end of the presentation. If you happen to have a question or if one pops up, feel free to just type it in your question box and we'll do our best to address it at the end of our presentation. With that being said, I will now turn it over to Dr. Mozoon.
Hi, everybody. Thank you for joining us. Yep, it's not moving. The slides are not moving. Click the screen. Apologize, but there we go. Okay, so I want to talk generally about immunizations first, and I'll try and include some information about flu vaccines as we go along. So vaccines are a way of producing natural immunity through the use of some engineered particles that replicate the coat of a bacteria or a virus generally. The earliest vaccines were actually killed bacteria or viruses that were injected whole, and they were a lot cruder than our current vaccinations in general. And they have now been more simplified. Vaccines have been more simplified to be even safer and more effective than those early vaccines. When you get an immunization, what is really happening is you're being injected with a little bit, if it's an injection, you're being injected with a little piece of the protein coat of the bacteria or virus that you're trying to gain protection from. And our bodies are really remarkable in their ability to recognize foreign proteins. So, you know, when you get a splinter, for example, that after a while you'll get a little pus around it because your body recognizes that there's a piece of wood in your fingertip and tries to get it out for you if you weren't able to get it out on your own. And that same immune response is what's responding to your vaccination, recognizing that there's some piece of protein there that's not human protein and learning to defend itself against that. So really, infections in general can be mild or severe. So there are lots of different cold viruses, for example, hundreds of them, and that's why we don't have vaccines against cold viruses because there's so many of them. And most vaccines are really developed against illnesses that are more severe, illnesses that would put you in the hospital, could kill you, have other lifelong consequences. And so, you know, we can put effort into developing vaccinations against milder illnesses, but so far the economics of that just don't work out. People wouldn't come in for vaccinations for, you know, milder illnesses. And so these more serious illnesses, the vaccinations are really relatively important compared to, you know, say some sort of vaccination against a little cold or a mild stomach upset. There are two types of infection in general. There are really a few more that are much less common, but in general, most infections are either viral or bacterial. A viral infection, basically the virus lands on a cell in your body, usually in your nose or your throat, and it injects its own genetic material, its DNA or RNA, into that cell, and it takes over the cellular machinery, and then it will start replicating itself using our cells. So it uses our body to make more viruses. And then those viruses go throughout our body and infect all the other cells in our body. And that's why we get illness symptoms that are kind of all over, high fevers, aches and chills, and sometimes pneumonia, sometimes vomiting and diarrhea. You get pretty much sick everywhere when you have a viral infection. Some vaccines against viruses are live viruses, but the virus has been weakened, so it only causes mild symptoms. So for example, the MMR vaccine and yellow fever and rotavirus vaccine are all live virus vaccines, but the symptoms that they cause are very mild. The live attenuated nasal flu vaccine is another live virus vaccine, and so people who get the nasal flu vaccine will get a little bit of a runny nose, get a little bit of a sore throat, but that virus has been modified so it can't live in the warmth of your body. It can't survive 98.6, and so it can only live in the colder temperatures of your nose and your a little bit in your throat. And so the symptoms are localized to that area, and you don't get ill, don't get the entire flu illness from that vaccine. The same is true for these other live virus vaccines. They are modified in a way that they don't make you ill all over, and they don't make you as seriously ill as the natural illness would. Some viruses have a protein coat that we've learned how to engineer in other sorts of environments. So the hepatitis B vaccine is made in a baker's yeast culture. HPV vaccine, they've actually figured out how to make the protein, and the protein turns itself into a little empty viral particle with no DNA. It's just the protein coat of the HPV viruses. So the science behind making these proteins has really developed over the last 20 to 30 years, and we're much more effective at making vaccines against viruses and bacteria that are not sourced from the illness itself, and are therefore much safer and much less likely to cause illness in the people who get them. So bacteria are a little different from viruses. Bacteria like to use us as a warm home and a source of food. And so they tend to infect one body part. You get an ear infection, or you get pneumonia, you get a bladder infection, but you don't tend to get it over your whole body. Your immune system might make you have a fever and chills as you respond to that, but the site of the infection is usually localized. Most vaccines against bacteria are copies of the bacterial protein coat, similar to most of our vaccines against viruses, and most of them are not live. The one exception is really oral typhoid vaccine, which most of us don't get unless we're traveling. So vaccines are using the body's natural germ-fighting defenses to produce immunity. So it's the same as natural immunity. It's just that what we're becoming immune to is a protein that's a non-human protein, and there's no genetic material or very little genetic material that can make us sick. And these antibodies or tags that our body produces that then stick to these foreign proteins, label those proteins as invaders, and then our spleen or white blood cells then target them and remove them from our system. So if we develop antibodies, these little proteins that our body uses to recognize foreign proteins, if we develop those from a vaccination, then what happens when the real measles virus comes along, when the real flu virus comes along, is that it's quickly targeted as foreign and removed from the system before it can take over our cellular machinery and give us the flu or give us measles. And so it's a really very effective way of protecting ourselves. And most of that immunity is very long-lived. So for example, tetanus vaccines tend to last for about 10 years. Measles vaccine tends to last lifelong. Yellow fever is a lifelong vaccination. So it's really useful because you never know when you're going to be exposed to these illnesses. So I think I've kind of talked about this slide, but the defense that our body is producing is the same against the vaccine as it would be against the real enemy. Some people ask, why do vaccines have to be a shot? And not all vaccines have to be a shot, but just underneath our skin, just as we respond to that splinter I mentioned earlier, just underneath our skin, we have a lot of immune cells that are capable of developing these antibodies or these proteins to protect against non-human proteins. And so that's why most vaccines are given by a shot, because the shot actually stimulates a localized reaction in the in the immune system that then becomes widespread in our body. There are a few vaccines that are given by mouth, but because these are proteins that are similar to the virus or the bacteria that we're getting protection against, they can also be digested by our stomach acid and our digestive system. So giving a vaccine by mouth is a little bit more complicated, and therefore it's less common. So our body is basically learning the proteins that we want to avoid before a serious infection comes along. And so we have a head start in the fight against any germ that might come to infect us. So vaccine reactions are something people often worry about. You get some soreness at the site of your flu shot or a little low-grade fever. And in fact, those reactions are generally signs that the immune system has recognized that foreign protein and is developing immunity. So it's not a pleasant thing, but it's a very good thing to have a little soreness after your flu shot, to have a little bit of achiness perhaps, or a little low-grade fever, because that means your body's immune system has been stimulated and your likelihood of protection is higher. Series of shots are sometimes needed, and booster doses for vaccines to make immunity levels longer lasting. So again, the tetanus shot is once every 10 years. We do flu shots every year because, not because the shot isn't long lasting, but because that's a very tricky virus that likes to change what it looks like. So if you think about, you can recognize a doctor by their white coat, but if you went to the doctor and the doctor had a white coat with bright red buttons on it, you might think, well, is that a doctor or is that something else? And, you know, so you see that person and you decide that they are a doctor, and that's great, but then the next time you visit them, they have a little ruffle on their collar and you're like, even less sure that that's a doctor. And that's kind of what the flu virus does. It changes every year, unfortunately, and there are multiple strains of flu viruses. So sometimes we predict that one strain will circulate and a different one does, or the one that we predicted to circulate does circulate, but it's changed its buttons and added a ruffle. So it's important to get that shot every year because we haven't developed one that can outsmart that particular virus and be a lifelong protection for us. So pregnant women, we now vaccinate much more often than we did when I first started out in practice. When I first started out in practice, we knew that pregnant women needed their tetanus boosters, but we didn't have whooping cough vaccine, and we would give flu vaccine, but we would only give it in the 3rd trimester. We now know that any inactivated vaccine is really safe in pregnancy. We still avoid live virus vaccines for anyone who's pregnant, but even the live virus vaccines, when they have inadvertently been given, for example, to a woman who didn't know she was pregnant, the risks are really, really minimal. And so, for example, yellow fever vaccine, which is live, if there's a yellow fever epidemic, we give that vaccine to pregnant women as well. Babies are born with a really competent immune system, but one that's had no exposure to any germs. And they benefit because the placenta can take the immunity that mother has acquired over her lifetime and transfer that immunity to the baby. And that immunity is pretty long lasting, around 6 months, sometimes even 9 months to some illnesses. And so when we give a pregnant mother the whooping cough vaccine, we know that that vaccine of the mother will boost her immunity and she will pass more immunity to the baby, and the baby will have improved protection against whooping cough for the first several months of life. We also know that that immunity, while it may modify the baby's own response to their first whooping cough vaccine, it doesn't modify it enough to make that vaccination series ineffective. So whooping cough is on the rise in the United States for a variety of reasons. Because people are not getting vaccinated as often because of the anti-vaccine movement, but also because we are using a vaccine that is less what we call reactogenic. We're using an acellular pertussis vaccine that's been out now since, I would say, the 90s. And we've discovered that that vaccine, while it causes less less fever and fewer reactions than the whole cell, less purified vaccine that we used in the past, it also is not producing as long-lasting of an immunity. Remember I said before that if you get a little fever and sore arm, that means you're getting a better reaction. Well, the whole cell whooping cough vaccine that most adults have received actually was a very robust vaccine, caused very good immunity, but also caused a lot of high fever, a lot of swollen thighs in kids, particularly at the 18-month shot, and high fevers with sometimes a febrile seizure. And so that vaccine was modified and improved through, purification processes and deciding which proteins we needed to be immune against, instead of having the whole killed bacteria injected. And unfortunately, the side effect is that, it's not as strong a vaccine. So that vaccine is included in the adult tetanus shot now. And when we give this vaccine to pregnant women, they can pass some immunity to the baby and protect the baby. And that is really important. So pregnant women should get flu vaccine and whooping cough and tetanus vaccines. The whooping cough and tetanus vaccine is a combination vaccine. And they should get that at every pregnancy. And it's flu vaccine is available now, so if any of you listening are pregnant, it's time to get your flu vaccine. Because babies haven't had any exposure to germs before birth, they're vulnerable to many more infections than those of us who have been around a while. And some infections are worse the smaller you are, the smaller your airway is, the smaller your body is, and therefore they're more common in young children. And children also cluster together and have poorer hygiene. If you have a toddler, you know exactly what I'm talking about. And so they spread germs more readily. So children get more shots because they're more vulnerable, because they've had fewer exposures to things in their life, and because the infections they get are more life-threatening. And so, the vaccines, the first vaccine developed really was the smallpox vaccine, but shortly following that were the vaccines for young children against illnesses that could kill babies and young children, for example, diphtheria and polio and measles. So we give vaccines at as young an age as they are both safe and effective. When you delay a vaccine that's known to be both safe and effective, you're really just increasing the risk that you're going to catch something that could have been avoided. And our current vaccination schedule, while it has lots of shots in it, it's been very well tested to be sure that not only are the individual vaccines safe and effective, but the combinations and the timing are safe and effective. And people talk about a rapid increase in the number of shots babies are getting, but on average, we've only added about 2 shots per decade to our vaccine schedule. So this really has not been a very rapid increase, and it's been very well studied. There are actually fewer of those foreign proteins. I hate that picture. I guess I should have taken that one out. Poor baby looks like a target, but there are actually fewer foreign proteins that babies are exposed to in the entire series that we give now than were in just the smallpox vaccine that was given in the 60s, because again, we have managed to figure out how to produce these proteins in a purer way with less use of whole cell or split virus vaccines. And the other thing about spacing vaccines out that parents don't really think about is it's very stressful to get one shot. You know how you feel when it's time for your annual flu vaccine. Even if you look away and you're trying to think of other thoughts, you're worrying about that injection. And they've actually shown that the cortisol and adrenaline response, the stress response to one shot, is the same as the stress response to 5. They're both maximal. Getting a shot is stressful. So if you have thought about spreading out your child's vaccines, you're delaying protection and increasing risk, and you're also making, instead of 1 visit, you're making 3 or 4 visits to get your shots caught up to date and increasing the stress to you and your child. So this is just the list of recommended vaccines. There are a lot of doses. The ones that have 3 doses, hepatitis B and rotavirus, and 5 doses, DPT and Haemophilus influenza type B, which is a bacterial meningitis, and pneumococcal, which is a bacterial meningitis. These extra doses are because the immune system doesn't respond very well initially, and so you need more doses in an initial series to get a good response. And then they have a booster dose, and the booster dose is basically helping your body re-stimulate its immunity and increase the level of protection. And the booster doses are generally given because the children are still at a vulnerable age. So, for example, while Haemophilus influenza type B has 4 doses, it is a vaccine that we don't even bother giving if you didn't get it before the age of 5, because really the illness is an illness of young children, unless you don't have a spleen. And so some of these vaccines are recommended for adults as well, if they have certain risk factors such as no spleen or cochlear implants, things like that. And as you get older, there continue to be vaccines that are recommended for you. So for ages 7 to 18, there are actually now 2 different types of meningococcal vaccine. The meningococcal ACWY, which is given in 2 doses at 11 and 16. And then there's a new meningococcal B vaccine, which is recommended for certain high-risk groups, but is also an optional vaccine that you can discuss with your pediatrician for kids who are 10 plus years of life. And that's recommended usually initially at around age 16. So they get that first dose with their second dose of the other meningococcal vaccine. We recommend HPV vaccine actually for all youth aged 9 and up. And if you start that vaccine young enough, under the age of 15, it only requires 2 doses. If you start it later, after the age of 15, it requires 3 doses. Tdap is a booster, basically, of the DPT vaccine that children got when they were less than age 5, and they get that at 11. And then the pneumococcal polysaccharide is, again, for certain high-risk children, for example, those with sickle cell disease. Young adults need vaccinations too, particularly booster doses for meningitis vaccine, HPV vaccine if they haven't gotten it, booster doses of the tetanus vaccine with or without whooping cough vaccine, depending on if they're pregnant or their risk factors. And so every age is recommended to get vaccination. And I'd like to really focus a little bit on the seasonal flu vaccine. So there are 4 viruses in most doses of the flu vaccine now, 2 A-type viruses and 2 B-type viruses. That's because, as I mentioned earlier, it can be kind of hard to predict what is going to circulate in any given year. And so, interestingly enough, flu circulates around the world year-round. And so in the tropics, you can get flu no matter what month it is. In the southern hemisphere, they have it during their winter, and we have it pretty much during our winter, and that's because of crowding indoors by and large. When we're all together in spaces over a Thanksgiving table or a Christmas table, then we're, sharing airspace and transmitting what we have. And, when you're able to get outside in the summertime, you usually don't have quite as much close exposure to people because you're out in the open air and people's windows are open and there's less internal air circulation, that's just recirculating in your house, for example. And so in the northern hemisphere, we see what's going on in the southern hemisphere, and we pick what viruses are most likely to circulate based on the most recent mutations and what's been, what buttons have been added, what ruffles have been added to the viruses. And so we select our vaccines based on the most recent information on exactly what are those foreign proteins on that flu virus that our bodies can respond to. And so that's done every year. They pick it in April, and then they go into production, and then come the fall, we have the vaccine available that we think is most likely to target the virus that's going to circulate. Of course, during that, April to September period, sometimes the virus has changed again, and that's why it's not a perfect vaccine. Most vaccines are very effective at preventing disease, but they don't work all of the time. So most of the childhood immunizations are around 90% to 99% effective, not really, very few that are really 100% effective. Flu vaccine is usually about 60% effective in preventing flu, but we've had some recent years where it was down to 26% or 40% effective. And so it's important to recognize that it's less effective in preventing getting flu at all, but it's really more effective at preventing hospitalization and severe disease. So even though you might hear that the vaccine is not terribly effective this year or last year, it still is likely to keep you out of the hospital and prevent you from dying from the flu. So in an outbreak situation, because most people, for most illnesses, for example, measles, have been vaccinated, the absolute number of vaccinated people who get sick might be more than the absolute number of unvaccinated people who get sick, because they're just a much smaller part of the population. And it doesn't mean that the vaccine doesn't work. So this slide set was put together with measles in mind in this regard. So when you hear about a measles outbreak, and some of the people who have the outbreak who caught measles have been vaccinated and maybe even had 2 doses, that's because some people's immune response to a vaccine is poor. And in the case of measles, it's about 2 or 3% of people won't respond to the vaccine. But what you don't see is the thousands of people who were protected because they were vaccinated. And so in any time you have an outbreak of measles, for example, you may have 100 sick people and 3% of them were vaccinated, or even 10% of them were vaccinated and 90% were not. Measles is particularly contagious, and before there was a measles vaccine, the number of people who got infected before the age of 15 was basically the entire population, because it's the most contagious virus that we have, and it's even more contagious than Ebola and other things that we worry about, that we probably shouldn't be too worried about. So what would happen if we stopped vaccination? Well, we really, unfortunately, we know this because it's happening around the world, because in Europe now there are thousands and thousands of cases of measles because of people's fear of the measles vaccine, and people are not very good at assessing risk. And so, they think the likelihood of getting measles is low when they don't vaccinate, and that the likelihood of getting autism or some other ill effect from the vaccine is high, because of stories that they hear. And in reality, vaccines are one of the safest interventions that we have to promote health, and are one of the largest contributors to our longevity in this country. In the past, hundreds of thousands of people got measles every year and died from, hundreds of people died from it every year. And now few doctors ever see measles unless they happen to live right now in New York or in Washington State. So this is just some statistics, but it's important to recognize that, you're increasing your risk of illness if you don't vaccinate. We know that, for example, people who don't get whooping cough vaccine are 27 times more likely to catch whooping cough than those who get it. So, am I running low on time? So, getting yanked from the side here, I thought. Oh, that was the last one. So, open for questions. How do I get to that?
All right. Thank you, Dr. Mozoon, for that presentation. We're going to get started with a few questions.
Well, since there are no questions, I'll give a little plug for getting flu vaccine. It's available now, and I would recommend that you get it by the end of October. That's a new recommendation from the Advisory Committee on Immunization Practices. It's actually not a totally new recommendation. They're just pushing it a little bit more because some people, we're all procrastinators, and some people put off getting their flu vaccine as long as possible. When I started doing immunization policy, there was sort of a thought that, you know, you should try and time getting your flu vaccine so that your immune response, which occurs 2 to 3 weeks after you get the vaccine, would hit you right around Thanksgiving, you know, or right around the time when flu is anticipated to start spreading in your community. But here in Houston, we've had flu outbreaks as early as April, and we've had it basically as late as May. So that's year-round, and so it's important to get your flu vaccine as soon as it's available in the fall, and certainly by the end of October. Let's see, how do I speak to parents? Here's a question. How do I speak to parents who don't want to vaccinate because of the fear of autism? And your daughter, who's 20 years old, is a student who refused the vaccine because it makes her sick. Well, when people tell me the vaccine makes them sick, that's when I respond, oh good, you got to take. You got some immunity to the vaccine. You don't want to get real sick, and the flu vaccine won't make you nearly as sick as the flu will make you. It'll give you a little low-grade fever or make you feel a little woozy for an afternoon or something like that, but it's not going to make you seriously ill. As far as parents who are afraid of autism with any vaccine, the primary focus has been the MMR for the anti-vaccinating community, but actually every single parent and every single scientific autism organization actually has on their web pages that vaccinations do not cause autism. So you can go to Autism Speaks, you can go to the Autism Science Foundation, you can go to basically any organization that's concerned with autism, and they basically all have a disclaimer on their website that vaccines do not cause autism. That's because the science is really, really clear. What's happened is with our social media, people spread misinformation, and fortunately, some of the social media sites are trying to remove some of that disinformation. Unfortunately, there is a pretty strong core of about 15 individuals out there that are really trying to spread this misinformation and have targeted certain communities, for example, the Orthodox Jewish community in New York State and the Somali community in Minnesota. So what I tell people is, you know, the best way to study a question about whether a vaccine causes autism or not is with a large population of people. You know, we all recognize that a shot is stressful, as I said earlier, and it's also something that is very memorable to us. We all remember when we got our last shot. And so just like, you know, say you might go to a Chinese restaurant and eat a particular dish, and then the next day you have an upset stomach and you're likely to blame that dish. Sometimes that's true and sometimes that's not true. And if something memorable happens to your child in proximity to a vaccine, it's very easy to blame the vaccine. In reality, autism tends to start early in the second year of life, and the MMR vaccine is given at 12 months, for example. And so there are going to be some people who have a child who has a diagnosis of autism close to the time of a vaccine, because vaccines are given so frequently. The way to tell whether that's really a cause is to have a large population of people and see, you know, of that large population of people, you know, what was the timing for the diagnosis of autism? Are there more kids with autism in the vaccinated group than in the unvaccinated group? That kind of large epidemiologic study is the best way to tell. And there's really no biological plausible reason why this vaccine should cause autism. Certainly natural measles infection did not cause autism, and there's no reason that a weakened form of the virus should cause autism. is the flu mist any better than the flu injection? And the answer to that is, in some ways, it really is. This is a live virus, and so it replicates in your nose, so it basically makes more copies, so your immune response is stimulated in more ways than it's stimulated with the injection. You actually get an increase in interferon and some other interesting immune molecules that basically even cross-protect you against strains that are not in the vaccine and against some cold viruses and other viruses. Now, the flu mist in the past few years, they've had a little bit of trouble with it not producing good immunity against one of the flu strains that was in it, and unfortunately that was the year that flu strain circulated, and so that was problematic. But I believe that they've fixed that issue and they figured out why that happened, and so that shouldn't happen again in the future. So I do recommend the flu mist for healthy individuals up to the age of 48. It's not intended for individuals less than age 2 or over 48. Any places offering free vaccines? So most vaccines now are basically free to people with insurance through the Affordable Care Act or any insurance. They're usually a no copay service that's provided, and the health department offers free vaccines, and your pharmacies often will vaccinate for free. Pharmacies in your grocery store or the pharmacy you visit, sort of as a way to get you into their space so you'll buy more product. So check with your pharmacy, or if you're insured, your doctor's office should give it to you with no copay. Are there any vaccines that cannot be given at the same time or at the, it might have been the same site? So most vaccines can be given all at the same time. I think the most I've ever heard of anybody giving anyone at the same time is 9 vaccines at the same time. Fortunately, we have a lot of combination vaccines, so you don't have to do that very often. Once you have a live virus vaccine like the MMR, we like to space out before you get another, space time-wise, not space out, space time-wise before you get another live virus vaccine, because your body's working against that live virus vaccine and it's replicating, and you might not get as good a take for the second one. So we usually space 2 live virus vaccines. If they're not given on the same day, we space them 28 days apart. You got your flu shot in October, and in July had a terrible flu. Is there a way to prevent getting the flu? So if you know, other than the flu shot, no. And unfortunately, by July, what can happen is the flu virus can mutate and add some new ruffles and change their button color. The best way to prevent the flu is to get vaccinated annually. The second best way is to keep some social distance. You know, if somebody's sick, try and stay 6 feet away. Clean surfaces with, you know, a disinfectant kind of wipe, wash your hands frequently, that kind of thing. There's a tissue that has a citric acid impregnated in it, so it's an antiviral tissue that's available in grocery stores and pharmacies. And it's not, I think, well enough advertised, but basically the citric acid kills the germs in the tissue so that if somebody else is picking up those germs, it's less likely to spread. And so I recommend that people use those tissues if they have the flu or a family member with the flu. Let's see, keeping, you know, hand gel around is a good idea. Was there any? There actually somebody asked another question about the autism, and no, there's been no science that supported any link to autism with vaccination. And you know, if you think about it, there have been a whole lot of changes in our environment and how we, you know, how we live from the 40s. And so the rise in autism rates, you know, there's so many environmental possibilities that that there are a number of those. For example, the sulfur in power plants emissions is another area that's being investigated. So there are other environmental things being evaluated for autism, but vaccines have been more studied than any other possible environmental cause of autism, and basically all the studies are negative. And why do people say it's immunizations is because there are people spreading memes that that keep that myth going, you know. So the live virus vaccine was taken off the market. The flu mist a couple years ago, it wasn't really taken off the market. Interestingly enough, they used it in Europe and it gave good protection because they had a different flu virus circulating. What happened in the US was the Advisory Committee on Immunization Practices suggested that we not use it for a year following a year in which it was not very effective. And then the company went back and determined why it wasn't effective. And actually the reason it wasn't effective was that that particular strain of the flu virus was not replicating itself in the nose of recipients very well, so they didn't develop immunity against it. So that's why it wasn't working, and they have fixed that problem with the current version, so it's back on the market and it's recommended. And there's a question, why do people with diabetes have to take the flu shot? Well, everyone over the age of 6 months really should get the flu shot. People with diabetes are at a higher risk to have complications of the flu, including their diabetes getting very difficult to control and a higher risk of hospitalization. So it's a good idea for everyone to get the flu vaccine. You know, we used to talk about people with particularly high risks being, you know, over 65 or people with certain illnesses, but now we recommend that everybody get the vaccine every year. Someone asked, will taking a Tylenol before vaccines aid you in not having so many symptoms? So it will not keep you from getting flu symptoms if you get the flu, but it will help with some of the fever and the sore muscles. Interestingly, though, there's some evidence in the pediatric literature that pre-treating people with babies with Tylenol before they get their vaccines may make them have a less robust response to the vaccine. So again, the fever and the sore arm are a normal part of your immune response, helping you to get a good take for that vaccine. So you can take a Tylenol and you'll have fewer symptoms perhaps, but you also may, it's not necessarily proven, but you may have a less immunity produced from the vaccine. Is Kelsey-Seybold offering Saturday or after hours appointments for flu vaccines? So we are just getting our flu supply in, and generally we do open Saturday appointments at our 5 Saturday clinics that are open for flu vaccines. And I wish I knew the answer to the after hour appointments, but I really don't. I know that those sites that are open later are likely to have some later appointments for the vaccine. And we will be opening some Saturday appointments probably before long. We got our first shipment in, and it really got used pretty quickly, or has been mostly used, and our second shipment is due soon. So we should be able to open appointments soon.
All right, so this is going to be our last question.
So I've got to pick one. Someone's saying, can hospitalized patients with upper respiratory infections get flu vaccinations during their hospital stay? And the answer is yes. So really, people with mild or moderate symptoms or mild or moderate illness can get vaccinated. It's a good idea for hospital patients to ask for the flu vaccine. If they're well enough to be discharged, they can get it. It kind of depends on why they're in the hospital. If somebody is in with a serious illness, then no, they shouldn't get their flu vaccine until they're recovering. But if they're in with a mild illness or they're in for some orthopedic issue, then they can get vaccinated during the hospital stay.
All right. Thank you so much, Dr. Muldoon. This will conclude our webinar. Thank you so much for doing an incredible job today. And I also want to thank you all for joining us this month. Please make sure you register for next month's webinar. And we will see you all next month. Thanks.